Hi everyone, thank you for joining me, Sarimah Ibrahim, in the ALTY's Bone Healthcare Series talk, where today we're going to be talking to another one of the fabulous surgeons. I say fabulous because they are at ALTY Orthopaedic Hospital. But just a little bit of an introduction. This series is to talk about and educate all of us, myself included, on how to care for our bones, our joints, our muscle, our whole basically musculoskeletal system. The word is very big because it is a very important thing. After all, that's what keeps us upright and standing throughout our life. A little bit about ALTY. It stands for Adding Life to Years, and here at ALTY they're all about giving you that quality life. You know, many people live for a long time, but do they have that quality of life? Can you still dance when you're 80, 90 years old? Can you play your favorite sports? Can you live without pain and discomfort? Well, it's possible if you get the right treatment at the right time, and that's what ALTY is all about. And there's also the HSC Screening Center here at ALTY, which is an established screening center. You may have heard of it, where you can check out all your health problems besides things to do with the bone and joint. So do come by and check out ALTY. And they also have a fantastic MRI, which is the first weight-bearing MRI and EOS imaging system. These are some really funky, technologically advanced machines here at ALTY. Now today, we're going to be focusing on slip discs. Now, a lot of us, like including myself, when we hear about slip discs, we're like, oh, it's a normal thing. You know, everyone gets slip discs. They went dancing too long, they slipped, they were wearing heels, they lifted something, the disc popped out. But we don't probably understand exactly what a slip disc is. Is it really dangerous? What should we do at what point with it? Does it take surgery to heal a slip disc, or will it go away by itself? So because of that, I'm here today with a person, a doctor, a surgeon, the man himself, a very established, known doctor, Dr. Lim Sze Wei. Hello, doctor.
Hello.
Dr. Lim is the consultant orthopedic, spine and trauma surgeon here at ALTY, and he's very well known, and he's a very smiley. You look very young. That's one thing I just wanted to say, Dr. Lim. For all of the things I've read about you and you know what you've achieved, you know, you look incredibly young. Is that something to do with your spine health, or is it that you do a lot of sports?
Yes, I'm quite active in sports, and I like to cycle and swim and occasionally play some badminton. Yes.
So you do, and I heard that recently Dr. Lim, he discovered deep sea fishing.
Oh yes, yes.
Where
that was
did
the
you?
first time.
How?
Actually, it was brought by my elder brother.
Okay.
Who took me to this deep sea fishing by the boat. We went inside the, open sea, and
wow.
yeah, that's the first time I
Sounds
did
a little bit scary. Yes. I went out on the boat by myself with my brother. He didn't throw you in for a joke
no,
or anything.
Not.
Maybe he wants you to chill, because I know that you do a lot of very intricate, important surgeries. From what I understand, you did a surgery here, a very complicated one. I'm not an expert, so I'm going to ask you about it. It took 14 hours of surgical time. This was something to do with 2 levels of the thoracic vertebrectomy. What is that? With a ribs resection. So that just sounds like an awful lot of medical terms. So what was that you did?
Oh yeah, I think that's one of the most complex surgery I've participated in, I think.
What does that mean in layman's terms?
This patient actually had cancer of the spine.
Okay.
We call it a sarcoma in the medical term, involving 2 of his vertebrae, thoracic vertebrae.
Okay.
And the cancer is basically straight to the ribs on one side, on the right side, involving 3 ribs. So we know that to reduce the risk of the spread of the cancer, we need to remove the cancer in one block.
Whoa.
Right.
Okay.
We can't just cut it into pieces and
that's why it took you 14 hours.
Yeah, that's why it's very complex, to remove the 2 vertebrae in one block together.
Amazing.
Yes, yes.
And how is he now?
Oh, he's doing great. He's walking around and he's back to his old job, and yes.
That's fantastic. See, so that's what's important. I mean, some people would say, why is it so important to take care of your bone, your spine and stuff? But it can make the difference between living and basically being alive, but sort of being like dead but alive if you can't move and enjoy the quality of your life. I know it sounds morbid, but you get what I mean. Right, okay, so Dr. Lim's here. He's going to explain to me and all of us what exactly a slip disc is. Because when we hear about slip disc, we're like, oh, it's normal lah, it happens lah, people go dancing, then they fall lah, people are lifting heavy things, it's not dangerous, but is it? Because from what I understand, from the little research that I do, and that I do understand from, it can get worse and it can lead to other disabling conditions, and that's something we don't want. So Dr. Lim, can you please explain to myself and everyone watching what exactly a slip disc is? Because people imagine it to be like, you know, like a disc just goes, pops out the whole thing. From what I can see in your hand, it's not quite, it's different.
Yeah. So slip disc basically is a layman term, right?
Okay.
To what we medically call prolapse disc or herniated disc.
Okay.
So to understand what slip disc is, we need to know what is the disc structure. So in my hand, you can see this a model of a spine.
This is from this,
yes,
obviously.
Right. So
okay.
our backbone actually made out of blocks of bones, actually connected together by this disc structure. This transparent thing is the disc structure, or you can see in my hand, this red color is a disc structure that connects two of the vertebral bone together.
Yeah.
It allows motion, and also it functions as a shock absorber.
So
right?
like in a car.
Yes. Correct.
So
that's
you
exactly.
don't feel the bumps, basically, of life.
Correct. So this structure actually consists of two parts, right? It's an outer ring, tough, fibrous-like structure that contain the inner jelly-like substance inside it, right?
Yeah.
So what happens is if the outer ring structure became weakened, and if there's a tear through, allowing the jelly-like structure inside to herniate out,
Ooh.
and when it herniate out, it can actually compress on the neural structure that's situated behind the vertebral body, causing the typical sciatica pain.
So can you squeeze that again? So that's what happens.
Yes.
So it doesn't come out like what we visualize, like a disc slipping out.
Yes.
It's more like a bulge of the jelly. So it's kind of like crab meat. You know when you squeeze crab meat and it comes out like that? That's how I visualize it.
Yes,
So
yes,
there it is,
exactly.
and that's a slip disc.
Yes.
So they can vary in sizes then, Dr.
Yes,
Lim?
of course, yes. It
So
can be
that
a
means-
mild, moderate, or severe if you want to make it simple.
Can I see that?
can,
So
yes,
mild, moderate, or severe. So what are the early signs of a slip disc? Oh my goodness, I can't even press it. I would never be a surgeon, obviously. Wait,
Yeah,
so
press
can
on
I
one
just,
side,
there
yeah.
you go. Okay, so I just wanted to go hard. So what would be the early signs like mild, moderate, severe? So mild slip disc, would I know I have a slip disc, or would I just be like, oh, it's just normal back pain?
I mean, the earliest signs, even before the jelly-like substance herniate out, just with the degeneration of the outer ring disc, they itself will produce some back pain. So I think back pain or even pain in the buttock, those are the earliest signs.
Really? All the way
yes,
down?
You have this degenerative disc disease. There's actually predisposes to this slip disc.
So can it be genetics? That's what I was going to ask you. Is it a genetic
yes,
thing?
genetic is one of the factors. It can run in the family. I mean, if you have a family member who are prone to get this slip disc, then you are actually prone to get one in the future.
You know, when you mentioned just now, when the outer area gets weakened, how does that happen? I mean, if it's all compressed so nicely, how could this possibly happen? What are the main causes of it?
I mean, our spine is like a mobile joint, right? So, I mean, it's subject to wears and tears. So, obviously, it's more prone to happen in those people whose work require carrying heavy objects.
So more manual,
Yes,
sort of
yes.
laborious.
Yes, of course. And also in those who are overweight, because of the pressure, increased pressure on the spine.
So weight does play an important
Yes, of
role
course,
then, doctor?
definitely.
Okay, so that's quite an interesting thing to understand, because Malaysians unfortunately are known to be one of the heavier Asians, right, within the region in terms of obesity issues. So is that possibly a reason why there are a lot of cases of slip disc in
Yes,
Malaysia?
I think slip disc is one of the most common reason that people go to see a spine surgeon or even orthopedic surgeon for their back problem. Yes.
Okay. And can you treat it non-surgically, Dr. Lim? Or
yes,
must
definitely.
it be surgical?
No. If you look at the evidence, actually up to 80% of people with slip disc, they tend to get better with conservative treatment, or we call a non-surgical treatment.
Right.
Yes.
Okay. So don't be afraid. If you do have a slip disc, whether it's minor or major, there are different sort of treatments available for you, both surgical and non-surgical. And here at ALTY, there's also physiotherapy care that is carried out as well. So we're going to just go into the first question. We've got a question from a viewer who sent this in, and it is from Adam in Ampang. He says his mom, 55 years of age, has been complaining of a lot of back pain, specifically lower back discomfort, but refuses to go to the clinic. She's probably one of those, you know, hard-working moms who are like, I'm fine, and she'll only take painkillers. So what do you suggest, Dr. Lim, in a situation like this with constant chronic back pain?
I would say you need to see a doctor if your back pain actually is a pain that limits your activity. I mean, the pain actually limits you in your walking or doing your daily activity.
Yes. Yeah.
Or if your pain actually persists more than a few days.
Yeah.
Yeah. Or if the pain is associated with some other condition, like say you have fever along with it, or you have some weakness or numbness in your hands or feet. So I think if you have those symptoms, you should see a doctor immediately and not to wait any longer.
Not wait any longer, because it could get worse, it could progress. So Dr. Lim, I'd like to understand, because sometimes, you know, you mentioned numbness and stuff, and now I'm freaking out, because can cold hands and sort of tingling be a sign that there's a compression in your spine?
Well, yes, I mean, tingling is part of a symptom that involve nerve, right? And the nerve comes from our spine, so it could possibly signify I mean, not necessary, but it could be a sign that you have some issue in your spine. Yeah.
So I need to get checked ASAP. Maybe it's all the years of karate, like 9 years of a lot of bouncing that might have done it. What do you reckon? Could be.
I mean, I do see a lot of patients, and one of them is like those karate, martial art teacher, or even yoga teacher, you know.
Oh my.
Sometimes they try to demonstrate certain
that's me.
activity or certain position to their student. Then they could hurt their back while doing that.
That's it lah. After this, when we come back after the break, I'm going to ask Dr. Lim to do a quick check on my back, because I'm wondering why I'm having these sort of numbing, tingly feelings. It's either that or I'm just very cold lah, basically lah. Who knows lah? Or maybe I drank too many cold things. Okay, we'll be back after the break with Dr. Lim. Interesting to find out more, because I don't have